Hi, I'm Dr. Richard Norden, and we are live here on Facebook in Ridgewood, New Jersey at our practice, which is Norden Laser Eye Associates. And what we're going to be doing over the next half hour or so is taking questions from anybody that would like to ask questions about LASIK. We're focusing today on LASIK, which is a procedure that's been performed in the United States for now about 21 years. Very successful. The most common elective procedure performed in the United States, and has the highest patient satisfaction of any elective procedure performed. So we're going to be taking questions. Feel free to post any questions on Facebook, and we'll try to take as many as we possibly can. And I'm here for you.
So let's start off with some myths. One myth is that contact lenses are safer than LASIK.
So we hear very frequently that contact lenses are safer than LASIK, and this has been shown in studies to be just not true. LASIK is far safer than wearing contact lenses. Around the world, over 30 million people have had LASIK performed. No one has ever gone blind. With contact lenses, in the United States, every year 50 people lose their eyesight from contact lens related infections. Now, it's not living dangerously. There are 30 million contact lens wearers in the United States, so it's about 1 in 600,000 per year, but it happens. It's certainly not something you worry about, because that probability is lower than many other probabilities we take every day when we just get in our car and drive somewhere. But the fact is, LASIK is actually safer than wearing contact lenses. And the typical reason people won't do LASIK is because of fear. And it's really an irrational fear. It's not based on any science. LASIK is safer than wearing contact lenses.
We have a question that just came in, and it says, I'm thinking about getting LASIK. What are some things I should consider?
Well, so this is a great question. What should you think about if you are considering having LASIK done? And I think today, in today's world with technology and our access to information, a smart thing to do is actually go and troll the web a little bit and go on the internet and try to pick up some basic information on LASIK. What is the procedure like? What is the procedure? What does it do for you? And that'll give you a basic fundamental idea of what we're talking about. But there are also a lot of not necessarily correct information on the internet. And so other things to do would be to go on various health rating websites like Yelp or Health Grades, and there are many of those that you can go on and look at a particular practice's ratings and how they do in terms of outcomes and just overall experience with a physician. And I would also speak to your friends. By now you probably know at least a few people that have had LASIK done, and ask them about their experience, where they got it done, what the results are, how long has it lasted. So these are things to do preliminarily. Now, once you've done all that, I would probably make a consultation with at least a couple of places just to get some general ideas as to what's out there and what your choices are, because I think it's very important, because these are your eyes. It's important to feel very comfortable to whatever location you go to have LASIK performed. And I think among the characteristics you should look for are, first and foremost, go to a place which does this routinely on an everyday basis. We all get this information, if you're going to have open heart surgery, you probably want to go to a place that does this every day, multiple times, not some place that does it once or twice a month, to get the best possible outcomes. And same holds true for LASIK. I don't think you should be going to places that do occasional LASIK and do a lot of other things. The second thing is, I would probably look for a cornea specialist. Cornea specialists work on the cornea, and that's exactly where LASIK is performed. So someone that has a good fundamental understanding of the cornea, it will be an advantage for you. Third, I think I would go somewhere in which you see the surgeon, first of all, before your procedure, and the surgeon has a large portion in terms of, or large role in evaluating you, which may be the most important thing in LASIK, to make sure your evaluation is proper and that you're an excellent candidate for LASIK. And again, if it were me, I'd probably want that same person to do my procedure and see me for my visits afterwards. So those are sort of the main things that I think you want to look for when you're looking for a LASIK surgeon. It's also helpful if that LASIK surgeon has trained other LASIK surgeons to do LASIK. I think as well, if that surgeon is someone that normally lectures at the annual meetings and the LASIK Society meetings, I think that's a very important thing as well. So I think you need someone that's well-rounded, that's academic, yet also does this on a regular basis. And I think lastly, just that you're comfortable in the locale, that the place you go to is clean, it's neat, the staff is courteous and competent, and so is the physician.
Great. We have another LASIK myth that contacts are less expensive than LASIK.
So many times patients feel that finances are the major obstacle to having LASIK performed. And there are many ways to finance LASIK. Most places do have interest-free financing in different terms from 12 months to 24 months to 36 months. And so LASIK can actually be more affordable than your monthly cable bill. And the fact is your cable bill you'll go on paying the rest of your life, whereas typically within 1 or 2 years you'll be done paying off your LASIK. Contact lenses over the course of a lifetime can cost $30,000 more, particularly even if you're buying backup pairs of glasses. That will add to that expense as well. So if you compare the cost of LASIK, which may cost you $5,000 or $6,000, which is not inexpensive, but compared to a lifetime cost of glasses or contacts, it's far less expensive. And particularly with affordable financing, it is less expensive than many of the things we pay for on a monthly basis today.
Okay, great. We have another question coming in from Montclair, New Jersey. And it says, I've read that LASIK is safe, but I'm still nervous about it. What can you tell me that will ease my concerns?
Well, so we have another question from Montclair, New Jersey. This person said they've read that LASIK is safe, but they still have concerns. And this is, again, probably the biggest issue that we deal with on an everyday basis. People are just scared. We're talking about a procedure on your eyes. And we've been told from a very early age, don't mess with your eyes because, they're the only things we have that we can see with, and certainly you don't want to take risks. So it's very understandable. And, decisions in life are basically, you have a scale with two options. And on one side, you have this optimism and looking forward to not having to wear glasses or contacts the rest of your life, and that's great. And you also have evidence-based medicine on your side, which tells you that LASIK is safer than wearing contact lenses, an extraordinarily safe procedure, and as it's evolved over 20 years, it's become even safer. So the risk of any serious complications is exceptionally, exceptionally low. On the other side of the scale, we have the human emotion, fear. And we know how fear can sometimes outweigh almost anything. But this fear is not based on science, it's not based on evidence-based medicine. It's based strictly on human emotion. It's normal. Everybody's petrified about having something done to their eyes. But the reality is LASIK is safer than wearing contact lenses. It's an extraordinarily safe procedure. It's evolved, as I said, over 20, 25 years to the point that it's safer than doing most things that we do in life.
We have another question coming in from Ridgewood, New Jersey, and they ask, how many LASIK procedures have you done in your career?
So we have a question from Ridgewood asking how many LASIK procedures that I've done in my career. And we don't have a hard, firm number to it, but we know it's more than 20,000. And this has been over 20 years. It's about 1,000 procedures a year that we are doing.
We've got another myth that eye doctors can't have LASIK done on their eyes.
So this is interesting. There was an ophthalmologist that was invited to the Dr. Oz show about 2 years ago. And he stated to Dr. Oz that LASIK is the one procedure that LASIK surgeons won't have. And many of us in the field intuitively felt, well, this is completely incorrect. And so myself and 3 other colleagues of mine nationally decided to do a formal survey of LASIK surgeons. And we surveyed 250 LASIK surgeons that were randomly chosen from a pool of LASIK surgeons. There are about 2,500 in the country, so we pooled about 10% of LASIK surgeons. And the results were this: 62.6% of LASIK surgeons have had LASIK done. So far from LASIK surgeons avoiding LASIK or not having LASIK, the majority of LASIK surgeons have had LASIK done. And still even a higher number did LASIK on their family members. Over 90% of LASIK surgeons have performed LASIK on one or more of their family members. So as a group, we strongly believe in LASIK. LASIK, percentage-wise in the population, about 10% of the population has had LASIK done. So 6 times more in the LASIK surgeon group, 62.6% versus 10%. So we believe in this procedure. We know it's safe, we know it's effective, and we know that people end up seeing better than they've ever seen before.
We have a question coming in from Livingston, New Jersey. What is the ideal age to get LASIK? What about the concern that your sight will change later on?
So there's a great question. When is the right time to do LASIK? Can you do it as a kid or as an adult, or are there upper and lower limits? And when LASIK was first FDA approved, the original number was age 21, and that was more of a legal age, and then it moved down to 18, but that's still a legal age where someone has the right to make some decisions over their body and procedures that are performed on them. What we're looking for with LASIK is what we call a stable prescription, and that relates to ocular maturity. And when we're born, our eyeball's a certain size, and as we grow and get a little bit older, the eyeball will grow. Particularly if you're nearsighted, the eyeball grows significantly, and it's only when the eyeball is fully grown, which we call ocular maturity, that the prescription no longer changes. Typically, the lower prescriptions will stop at an earlier age, and higher prescriptions will keep getting worse, sometimes as late as age 25 or 26 even. The way we know it's changed is if we have a constant prescription 2 years in a row. So let's say someone has a -3 prescription when they're 15 and they're -3 when they're 16, we can say that eye is ocularly mature now and they're ready for LASIK. On the other hand, you might have someone with a -9 prescription at age 22 and they're -10 at age 23 and they're not ocularly mature, so they're not ready. There's no strict age for anybody per se. It's for that individual when the prescription stops. So we have done LASIK on kids as young as 14, and sometimes we'll wait till they're 25 or 26 if they have a higher prescription. On the other side of it, we have done LASIK on patients that have had cataract surgery and corneal transplants, and some of them are in their 80s and even 90s. So there's no really upper age. Generally, if the eye has other eye health issues like advanced cataracts or glaucoma or corneal problems, we probably will not perform LASIK on those patients. But in terms of age limits, again, there is no strict age limit on either the lower end or the higher end.
We have a question coming in from Hoboken, New Jersey. What eye problems can LASIK cure?
Well, so this question addresses what conditions can LASIK cure. And the short answer is there are 4 different conditions, and they're related to prescription, of course. So the first and most common, and the one that was first FDA approved, was nearsightedness. And so LASIK today can treat up to between 12 and 14 units of nearsightedness. We would call those units diopters, but we can treat from as low as 0.25 diopters of nearsightedness up to 14 diopters of nearsightedness. So there's a very large range in people who are so-called considered blind as a bat or have Coke bottle glasses. Those people are now candidates for LASIK by and large. The second condition that we can treat is farsightedness, and those people are people that typically did not wear glasses until they hit age 40 or 45 and started to wear reading glasses first, and then a number of years later needed either progressive lenses or bifocals because their distance vision had failed them. So we've been able to treat farsightedness for many years as well. We can also treat astigmatism. And astigmatism is really a condition in which your cornea is shaped like a football cut in half rather than a baseball or a basketball. So the curve is different in 2 directions, 90 degrees apart. Whereas in nearsightedness or farsightedness, the cornea is shaped more like a baseball or basketball cut in half. And with LASIK, what we do is we correct whatever the prescription is, and then we take that football shape and turn it into a baseball or basketball shape. So we've been doing that for many years. The majority of people have either nearsightedness and some astigmatism, or farsightedness and some astigmatism. So we can treat any combination of those three. And then the last condition, which happens to be a specialty of mine, is people that just wear reading glasses. And a lot of people don't know this, and it's not commonly out there, but we can do LASIK. We do a procedure called monovision, in which the distance eye is left alone if it's good, and we take the non-dominant eye and we turn it into a reading eye, so that with both eyes open you see great far away and great up close. So we can actually eliminate reading glasses. So again, to summarize, we can treat nearsightedness or myopia, we can treat astigmatism, we can treat farsightedness or hyperopia, and we can treat reading glasses, which is also known as presbyopia, and any combination. So almost any prescription that you might have, we can treat.
There's also a myth that you can't have LASIK if you serve in the military or law enforcement. Is there any truth to that?
So the next question is about, can you be in the military having had LASIK performed, or if you're in the military, can you have it performed? And the answer is a wholehearted yes. The military, many times the military will have surgeons, military surgeons, that will perform LASIK on the military. It's been approved by all 4 branches of the military, Navy SEALs, even the astronauts, although we're not necessarily military there, have LASIK approved. So if you think about this, in life and death situations where you're relying on the other guy in the foxhole, if the military feels that LASIK is safe enough to perform on that group of people, it's pretty safe for all of us.
There's also another myth that LASIK surgeons are all the same, so it's best to just find the best deal.
So this is, LASIK surgeons aren't all the same, and that's also true of pretty much any type of surgery. I think that, if you, God forbid, need to have brain surgery and you have a brain tumor or a hemorrhage, I think the last thing you're going to do is go out there and shop for the cheapest neurosurgeon. And I think the same is true for LASIK. To run a practice properly, to have state-of-the-art equipment, to have staff that has been there long term and experienced, and most importantly to have a trained surgeon. Price is not the most important issue by any means. If LASIK were completely automated and there was no difference in terms of outcomes, of course price would be an issue, but I think that's probably the last place that you want to shop on price. After all, these are your eyes, and the results are yours for the rest of your life, and the difference in surgeons can make a difference in outcome.
Another question we just received from Twitter is, when I book with Dr. Norton, will I be seeing Dr. Norton?
So this next question is, if you book a consultation at Norden Laser Eye, will you be seeing me? And the answer is, I'm afraid you're stuck with me for every single visit. So I'm going to see you and do your consultation. I'm going to personally measure your prescription. I'm going to look at all your tests, and I'm going to do your procedure, and I'm also going to see you every single visit afterwards. So the answer is, maybe it's a little boring, but you're stuck with me the entire time.
We also have a silly question that came in from Twitter. What if I have to blink or sneeze during the procedure?
Okay, so a silly question from Twitter. It's not really silly at all, and people have this concern. What happens if I have to blink or sneeze during the procedure? And the answer is, you, as a patient, can't mess this procedure up. That's usually pretty comforting to people, because everybody's afraid they're going to look in the wrong place, they're going to close their eye, they're going to sneeze, they're going to do something silly and mess up their procedure. And frankly, you can't. And here's why. First of all, your head is being held in place by a firm rubber donut pillow, so you can't really move your head very much. Second thing is, the eye that we're working on is being held open with a metal eyelid holder called a speculum. And as hard as you might want to squeeze your eye, you will not be able to squeeze your eyes shut, and so you can't close your eye during the procedure. If you sneeze during the procedure, normally we close our eyes when we sneeze. You can't close that eye if you sneeze in the middle of the procedure. The last fail-safe mechanism that we have is that we have an eye tracker. And this is a three-dimensional tracker built into the laser. When I look through the laser at your eye, we have a bunch of concentric rings that shine on your cornea, and I know it's in the perfect position. And I step on a pedal, and it takes a picture of your eye in the perfect correct position. As your eye makes little movements while we're lasering, and trust me, everybody's eyes make little movements as we're lasering. So as your eye makes little movements, the laser beam will move with you. The tracker in the laser moves much faster than human eye movement, so it can easily keep up with any movement that you make. Now, if in the middle of your 5 seconds of lasering you decide you want to see what time it is on the clock on the wall, now you're probably not going to do this, but let's say you did. The moment you come off the captured position, the laser will shut off and it won't turn back on until you come back to the correct captured position. So you as a patient can't mess this up.
Another question from Facebook. What are some of the things that people say to you after getting LASIK?
Some of the things that people say to me after having LASIK done, Doc, I didn't realize you were that good looking. No, kidding. People will say things like, this is the best thing I've ever done, best money I've ever spent. Sometimes people are just in tears. They're just so happy. Imagine people that, would get up in the morning and could barely in the shower, and guys can shave in the mirror where they couldn't do that before. This is a life transformational procedure. It really does change people's lives. So people are ecstatic, and again, the common thing we hear, it's the best thing they've ever done.
Does LASIK get customized for the individual's needs and eyesight?
So the next question is, does LASIK get customized for the patient's individual needs and eyesight? We actually trademarked custom LASIK about 15 years ago, and we go through a very lengthy process to make sure that each person has LASIK customized for their eyes. That includes doing monovision, which is different for many people at different ages. People typically need stronger reading eyes as they get older, so we give them the amount that they need for their particular age. We also will customize the distance, but we have quite a number of musicians from the New York Philharmonic, and they need to see the conductor at a distance. They also need to read their sheet music, which is about 3.5, 4 feet away. So when we do their monovision, we customize to those distances. But every eye is customized. Measurements on the eye are done, and the laser, as it's doing its treatment, based on the measurements we've done, it adjusts itself to customize for the topography of every individual patient.
We've got another question from online. How long does it take to recover from LASIK?
So we have a question online. How long is the recovery from LASIK? And there are a couple different answers to that because there are different stages of recovery. But I think to most people, it means, when can I go back to everyday activities? What can I do? What sort of restrictions do I have after LASIK? And we tell people for the first 4 days, you don't want to get hit or kicked or poked or bitten or stomped or licked or pawed in the eyes. After 4 days, you can go back to that if you like, but I don't think most people want to go back to that. But the reality is the next day, you can run, you can jump, you can lift. If you bench press 200 pounds, go bench press 200 pounds. We don't want you to clunk yourself in the eye with a dumbbell. Not that that's ever a great idea, but right after LASIK, that's particularly not a good thing to do. But really avoiding trauma to the eye is the most important thing. But in terms of activities, exertions, dancing, running, all the normal things, showering the next day, you can do all of that. We do have you wear protective shields the day of the procedure, and you go home in those, but the next morning you take them off and you do not have to wear them again. So you really have no restrictions or limitations other than eye makeup for a couple of nights and not getting hit in the eye. But other than that, you have full activity starting on day one.
We have another question from Facebook, and this was also asked on Twitter. Can you go blind?
Well, anything, of course, is possible at any time. People say, what's the worst thing that could happen during LASIK? I say, well, the worst thing that could happen is I could die, or we could have a terrorist attack on the building. But again, none of those things have happened so far. We don't expect them to. Now, the good news with LASIK is, with the millions and millions of people who've had this done, no one's ever gone blind. Are you likely to be the first? Highly unlikely. And again, percentage-wise, it's 0 so far.
Another question, how long does LASIK take?
The next question is, how long does LASIK take? And in our practice, typically, you're here for an hour and a half to 2 hours on the day of your procedure, but when we take you into the room to do LASIK, you're there for no longer than 10 minutes. I'm working on each eye for about a minute and a half. We talk to you through the entire procedure the whole time you're in the room when we're getting prepared and setting up. And then as I'm doing things, I'm not gonna tell you what I'm doing, you don't really want to know, but I will tell you what you're gonna be feeling prior to every step along the way. So you're in the room 10 minutes, I'm working on each eye for about a minute and a half.
We have some requests for you to talk about trends in healthcare, specifically in eye care.
Okay, please.
They just want to know if you've noticed any new technology and if there's anything you're noticing in the industry itself.
So, with regards to LASIK, LASIK has improved now over 21 years. I can give you lots of boring details as to software and hardware improvements that we've had, but I don't think that's really what people want to know. I think what people want to know is, from a functional standpoint, is LASIK better than it was 20 years ago, 25 years ago? And the answer is a resounding yes. 15 to 20 years ago, we used to tell people, you know what, you're going to see almost as well as you see with your glasses or contacts. If you're really lucky, you'll see as well as your glasses or contacts. Today, we can tell people almost all of you are going to see as well as your glasses and contacts, and probably about 98% will see better than you've ever seen with your best pair of glasses or contact lenses. So the sum of all this technology is, whereas 20 years ago people were seeing almost as well as their glasses, today they're seeing better. So that is a huge, huge improvement over that period of time. Additionally, in the old days of LASIK, or what we call our parents' LASIK, people used to have some issues with dry eyes after the procedure, sometimes for 3 months, 6 months, or longer. People used to have issues with night glare and vision difficulties at night. Today, in fact, surveys have shown, and the most recent survey of over 58,000 patients has shown that only 0.85% had any issues that were longer than a short period of time after LASIK with dry eye. Additionally, the vast majority of people had improvement in night vision. So rather than in the old days having difficulties with night vision, in fact there is improvement today with night vision. So those are the three major improvements: the quality of the vision, that it's better than glasses or contact lenses, the improvement in night vision, and then also the lack of dryness afterwards.
We have one last question. Are there financing options for LASIK?
So one last question is about financing for LASIK, because as a chunk of change, $5,000, $6,000, $7,000 is a fair amount, and people sometimes look at that and say, well, I can't afford that, even though they're spending not far from that on glasses or contact lenses, maybe over a slightly longer period of time. But today we do have all sorts of options. You can finance this over many years. You can do interest-free financing over 12 months, 18 months, 24 months, and we can tailor this to your budget. So you can do this as low as $99 a month if you choose. And most people can swing that, if you, again, compare it to your cable bill or, your phone bills or things like that. So LASIK today is really quite affordable. And of course you can mix and match. You can write a check, you can pay with a credit card, or a combination of financing and any of those other options. So today I think the last obstacle to getting LASIK done, which is making it affordable, is it is now affordable with interest-free financing.
And how can people book with you?
So this is a very important question. How can people book with Norden Laser Eye? And the answer is really quite simple. You can book an appointment online on our website, which is www.nordenlasik.com. That's NORDENLASIK.com. Or you can just call our regular number. We have extended hours and answering abilities up until 8 o'clock at night. And that number is 201-444-2442. And that's 201-444-2442. I'd like to thank everybody for their attention and you'll be able to access this on Facebook anytime you like.